Well, that's it. That's the tabletop simulation. Now, let's take a few minutes to talk about what we did.
Yes, let's debrief what we just did.
That's a great idea. So, what went well?
Walking through the process helped me understand the checklist better and highlighted some items that we might consider changing before we use it in the OR.
Well, what did we learn?
I think it's easier to read items that are written out as questions. I mean, for instance, is everyone ready to perform the timeout? Can we just write out the questions that we want to ask so we can just read them directly from the checklist?
That would be helpful. On the pre-op checklist before the patient enters the room, could we change this part to say, has the surgeon initialed the site for the procedure?
Okay.
I'm wondering if we really need the part on the pre-op checklist that talks about risk of venous thromboembolism. Most of our patients don't need VTE prophylaxis.
Well, that's true, but there are a lot of different procedures being performed in these rooms, and our patient population is changing. Our patients are sicker than they used to be, and their care is becoming more complex. I think we should keep it on our checklist as a reminder.
Good point. I have another question though. It seems a little awkward to talk about patient positioning in the pre-op checklist.
I was talking to Joe about that, and he told me that it's safe practice for the team to discuss patient position pre-op. It helps us double check the prep of the OR bed as they enter the room.
Thanks, Seth. Your explanation makes sense and shows us why it is important.
There's another part of that checklist that I'm not really comfortable with. On the briefing section of the operating room checklist, it says that the surgeon should say, does anybody have any concerns? If you see something that concerns you during this case, please speak up. Now, Mindy, I agree that including this would be helpful on our checklist, but the words that are written here don't feel natural.
Okay.
I'm going to talk with some of the other surgeons here and at some of the other centers I work at and see what they think.
Okay, please get back to me after you've done that. In the meantime, I'll make the changes that you've all suggested.
After you change it, will we run through this simulation again to be sure that we've got it right?
Absolutely. We'll have another tabletop simulation, and once we're sure it's ready, the next step is to test our checklist in one OR with one patient. Dr. Lopez, would you be willing to let us try our checklist in one of your cases after we've made the revisions and we try it again in a tabletop simulation?
Sure, I'm okay with that. I'll inform the patient right before pre-op to get their consent.
Great. I think we've got a good plan.